Usually, um, when you think about fixing a physical problem in your body, the math feels pretty simple. Like if you want to lift heavier boxes, you just do some bicep curls.
Right, exactly.
Or, if your knee feels unstable, you do squats to build the muscle around it. It's just basic mechanics.
Yeah, it's a very comforting linear progression. I mean, you identify a weakness, you add resistance, and the muscle adapts. It makes sense.
It completely makes sense. And the most universally accepted rule of fitness and rehab seems to be that if a muscle is failing, or if it's weak, you just strengthen it. It's almost an instinct for us. But what if I told you that for a huge portion of the population, doing exactly that, like strengthening a struggling muscle, will actively make the problem worse?
It really completely upends decades of standard medical advice. Especially when we start talking about the pelvic floor, we are looking at a diagnostic landscape that is entirely counterintuitive.
So if you're listening to this and you've been doing hundreds of Kegels at every stoplight because someone told you it would fix your pelvic pain or you're leaking, you are definitely going to want to hear this.
Oh, absolutely.
We are taking a deep dive into clinical guidelines, physical therapy research, and specialist insights regarding hypermobility spectrum disorders, or HSD, and Ehlers-Danlos syndrome, EDS. And the big question we are tackling today is, can overstrengthening actually worsen symptoms in hypermobile pelvic floors?
So to understand why that happens, you really have to look at how society views hypermobility versus what it actually is.
Right.
People often treat it like a fun party trick, being double jointed or being that person who can easily contort into the splits in a yoga class without stretching.
Yeah, the really bendy person.
Exactly. But hypermobility spectrum disorders and Ehlers-Danlos syndrome are systemic conditions. I mean, they are fundamental structural differences in the body's collagen.
And collagen is essentially the glue of the human body, right?
Yeah, it is the primary building block. It forms the ligaments, the tendons, and the scaffolding that literally holds our internal organs in place.
Right.
So in a typical body, ligaments are like thick, stiff, highly resilient cables. Their entire job is to stop a joint from moving too far out of its socket. But in someone with HSD or EDS, that collagen is structurally different.
How so?
It's highly elastic and much less resilient. So from the very outset, the tissue that supports the joints and the internal organs is fundamentally looser.
Okay, and this is where the pelvic floor comes into play. Because I think most people just associate the pelvic floor with, bathroom functions or maybe childbirth.
Right, that is the common perception.
But the clinical literature emphasizes that this hammock of muscles at the bottom of the pelvis is actually one of our primary hip and core stabilizers. Like it physically holds up the pelvic organs, the uterus, the bladder, the bowel.
And the thing is, it doesn't do that job alone. It relies really heavily on passive stabilizers. The ligaments suspend the organs, and the fascia creates a supportive web. But think about what happens when those passive stabilizers, like the ligaments, are too stretchy. The body's nervous system instantly senses a profound lack of stability.
So the brain basically realizes the skeleton is slipping around.
Yes, exactly. It senses immense vulnerability. And to compensate for those loose ligaments, the body recruits muscles to do a job they were never designed to do full-time.
Oh, wow.
The muscles start to grip, brace, and guard constantly just to hold the skeleton together.
Okay, so think of the pelvis like a tent. Normally you have these strong, stiff ropes representing the ligaments, and they hold the tent poles securely in place.
Right, the tent stands up completely on its own.
Exactly. But in a hypermobile body, those ropes aren't stiff. They are made of, stretchy bungee cords. So if the wind blows even a little bit, the tent is going to collapse.
That is a perfect analogy.
And to prevent that, imagine a person, which represents the pelvic floor muscles, has to stand inside the tent, physically gripping and holding the pole together 24 hours a day, 7 days a week.
And just think about how exhausted that person inside the tent is going to be.
Yeah, they would be wrecked.
Absolutely. In medical terms, this constant gripping leads to what we call a hypertonic pelvic floor. The resting muscle tone becomes completely elevated.
Meaning the muscles are just overactive and tense?
Yes, they are physically unable to let go, and this sets the stage for a massive clinical trap.
Because the pelvic floor is acting as this overworked emergency brake, its baseline state is altered, right? Which changes everything about how a doctor or physical therapist has to treat it.
It does, and this requires defining two critical terms, hypotonic and hypertonic. Hypotonic means the muscle is genuinely underactive and weak. It just lacks resting tone.
Okay, and hypertonic?
Hypertonic means it is too tight, overactive, and guarded.
There's a staggering stat in a clinical practice guideline from the journal Obstetrics and Gynecology. They noted that high-tone pelvic floor dysfunction, like the tight kind, is reported in around 63% of patients presenting with chronic pelvic pain.
Wow.
63%. That is huge.
It is incredibly prevalent. But here's where the trap snaps shut on patients. A hypertonic pelvic floor and a hypotonic pelvic floor produce almost the exact same list of symptoms.
Which is what makes it so confusing. If you read the symptom list, both a tight pelvic floor and a weak pelvic floor can cause urinary incontinence, fecal incontinence, and pelvic organ prolapse.
Which is that really awful, dragging feeling of heaviness.
Right, and also severe constipation and painful intercourse.
Yeah. And because the symptoms mirror each other so perfectly, the standard knee-jerk medical advice for decades has been, oh, you're leaking, you have pelvic heaviness, your pelvic floor must be weak. Just do Kegels, strengthen the muscle.
But hold on, I need to push back on this symptom overlap for a second.
Well,
Because it just doesn't make intuitive sense.
how so?
Well, if the muscle is stuck in a super tight contracted state, why does it leak urine? Shouldn't a constantly tight muscle act like a closed valve and hold things in even better?
That is such a common misconception. A healthy muscle doesn't just need brute strength, it requires dynamic range.
Dynamic range, okay.
Yeah, it has to have the capacity to contract powerfully to hold back urine and then fully, completely relax to let it out. A hypertonic muscle is already clenched as tightly as it can go at its resting baseline.
So it is just rigid, exhausted, and stiff.
Exactly.
It has absolutely no range of motion left.
Precisely. So when a sudden load occurs, like let's say you sneeze or cough or pick up a heavy grocery bag, the muscle has no excursion left. It cannot contract any further to meet that sudden increase in abdominal pressure.
Oh, wow. So it simply fails and you leak. Not because it's weak, but because it is exhausted and totally maxed out.
That is exactly right.
There's a really brilliant visual for this in one of the NHS resources. Imagine holding your hand in a tightly clenched place for days, weeks, or even months.
Oh, that sounds so painful.
Right. Think about how agonizingly sore the muscles in your hand and forearm would be. You wouldn't be able to grip anything new.
Right, your grip strength would be basically zero.
Exactly. And that is exactly what is happening in the hypermobile pelvis. It's holding tension that leads to radiating pain in the lower back, the hips, and the abdomen.
And this is exactly why prescribing traditional strengthening to a hypermobile person is so dangerous. If you tell an already maxed out hypertonic muscle to contract even more through hundreds of Kegels, you drive it directly into complete muscle failure.
Yikes. So the pain worsens, the leaking gets worse, and the dysfunction increases.
Exactly.
Okay, so a mechanical problem requires a mechanical solution, right? But the sources show it's actually much deeper than just loose joints and overworked muscles.
Oh, it goes way deeper.
There is a whole neurological loop happening here that locks the hypermobile person in a vicious cycle.
Yeah, you absolutely cannot separate the physical tissue from the neurological signals driving it. They are completely intertwined.
In the literature, specialists constantly refer to this trifecta of conditions that show up together.
Yes, the big three.
Right, so you have EDS or HSD, which are the loose joints. Then you have MCS, which is mast cell activation syndrome, and autonomic dysfunction.
And the most common one there is POTS, or postural orthostatic tachycardia syndrome.
Right. So tell us about the autonomic nervous system.
Well, it is basically the body's autopilot. It controls all the involuntary processes, so your heart rate, blood pressure, digestion, temperature regulation, and bladder function.
Okay.
In hypermobility, this autopilot is frequently malfunctioning. Let's look at POTS specifically. Because the connective tissue is stretchy, the blood vessels themselves are also stretchier.
So when a hypermobile person stands up, gravity pulls the blood down, and those stretchy veins don't constrict enough to push the blood back up to the brain.
Exactly. The blood pools in the lower extremities, so the brain realizes it's not getting enough oxygen, and it basically panics.
Which makes sense.
Right. It tells the heart to beat faster and harder to pump that blood upward, and this triggers a massive release of adrenaline and epinephrine. The nervous system is suddenly hovering in a state of overdrive, a literal fight or flight response just from the act of standing up.
Oh man, that is intense. And then you add MCS into the mix, where the body's immune system is overreacting to normal stimuli and causing systemic inflammation. So the brain is essentially receiving a constant stream of threat signals.
Yes. And what does a human body do when it genuinely believes it is under attack? It braces.
Right, it tenses up.
That heightened sympathetic nervous system tone promotes chronic global muscular tension. The brain is constantly commanding the body to guard against a perceived threat.
So the pelvic floor, which is already working overtime to hold those loose joints together, just tightens even further.
Exactly. It's a compounding effect.
And this neurological panic heavily impacts the breath, which seems to be a massive piece of the puzzle here. Like, there is a mechanical piston relationship between our breathing and our pelvic floor.
Yes, the piston is such a great way to visualize it.
When we take a deep, relaxed breath in, our diaphragm lowers, and the pelvic floor is supposed to naturally expand and drop down to make room for the internal organs. And then when we exhale, it recoils back up.
But habitual breath holding or shallow chest breathing, which is the default state when you are anxious and your body is bracing, completely disrupts that natural rhythm.
Right.
The diaphragm barely moves, which means the pelvic floor never gets the mechanical signal to expand and let go.
So if the brain is treating a normal breath like a 5-alarm fire, standard physical therapy is just going to fail.
Yeah.
I mean, you can't just exercise your way out of a nervous system panic.
No, you really can't.
So how do specialists actually get the body to stand down? Like, how do you convince the body that it's safe to finally let go?
It comes down to a concept called interoception. Interoception is your brain's perception of the internal state of your body. In a hypermobile brain, normal internal signals, like a slight change in digestion or a minor shift in a loose joint, are amplified. The brain interprets them as massive, catastrophic threats.
Wow.
Yeah, you
Okay.
cannot simply command a hypertonic muscle to relax when the brain is screaming that relaxing will cause the skeleton to literally fall apart.
You have to retrain the nervous system to feel safe.
Exactly. And the primary gateway to do that is through the breath and specialized physical therapy.
Right, because standard fitness advice is often actively harmful here.
Oh, it really is.
The golden rule of treatment that kept popping up across all the physical therapy literature is this: you must unwind before you can strengthen.
Unwind before you strengthen.
Yes.
Yeah.
Down training and relaxation are the critical first priorities to restore a normal resting tone.
Which means throwing out some of the most common fitness cues we hear every single day.
Wait, I need to stop you there because literally every personal trainer on earth tells you to, like, pull in your abs, sug your stomach in, or activate your core before you do a squat or lift something heavy.
Right, to protect your back.
Yeah, exactly. Are you saying hypermobile people shouldn't brace their core?
Well, there is a massive difference between dynamic core stability and rigid, panicked bracing.
Okay, explain that.
When a trainer says suck in your abs, most people respond by holding their breath and clenching their abdominal and pelvic floor muscles as hard as they can.
Guilty. I definitely do that.
We all do.
Right.
But for a hypermobile person whose muscles are already locked in a hypertonic state, that cue is terrible. It just adds fuel to the fire.
Right, because they are already totally clenched.
Exactly. It increases intra-abdominal pressure and forces the pelvic floor to bear down even harder. They don't need more rigidity. They need dynamic, responsive stability that moves with their breath.
To teach that, specialists use some really fascinating tools, like biofeedback is a major one.
Yeah, biofeedback is incredible. It involves placing small external sensors on the muscles to measure their electrical activity.
So they can see what the muscles are doing.
Right. It allows the patient to actually visualize their muscle tension on a computer screen in real time. They can see the line spike when they tense up, and they can learn what true relaxation actually feels like when the line drops.
They also use real-time ultrasound, which I found so fascinating. A specialist will use an ultrasound wand on the lower abdomen to look directly at the pelvic floor muscles.
It's amazing technology.
Yeah, and the patient is lying there on the table, completely convinced they're relaxing. But the therapist points to the screen and says, look, your muscle isn't moving at all. It's completely locked.
Talk about a reality check.
Right. It physically proves to the patient that their brain and their muscle have lost the ability to communicate properly about letting go.
They also utilize gentle manual tissue release to address fascial restrictions alongside highly focused diaphragmatic breathing.
To restore that piston rhythm we discussed earlier.
Ex-
Thinking about what that patient is experiencing on the table. For a hypermobile person whose tight muscles are quite literally acting as the structural integrity holding their loose joints together, being told by a therapist to just relax their pelvic floor must feel incredibly vulnerable.
Oh, completely.
It's like telling someone to take their hands off the steering wheel while driving down a really bumpy, dangerous road.
That is a brilliant way to put it. It is terrifying for the nervous system.
Yeah.
And this is exactly why the treatment cannot be forced. A therapist can't just forcefully massage the tension away or demand the body let go. If they do, the body will just panic and tighten right back up the second the patient walks out to the parking lot.
Because it still feels it needs that emergency brake.
Right. It requires what therapists call graded exposure. It's a gentle, methodical process of teaching the body entirely new, safe movement patterns.
Okay.
You slowly build dynamic stability in other areas, the hips, the glutes, the deep transverse abdominals, so that the nervous system realizes it has other, better support systems.
You are giving the body a much better steering wheel, so it doesn't need to use the pelvic floor as an emergency brake anymore.
That is exactly it.
So let's bring this all together.
Okay.
If you take away only one thing from this deep dive, let it be this. If you have a hypermobile body, your pelvic floor issues, like the leaking, the pain, the prolapse, are very likely caused by tightness, not weakness.
Yes, tightness, not weakness.
Overstrengthening an already hypertonic muscle with Kegels will only lead to further pain and dysfunction. The path to healing isn't found in a generic list of exercises.
No, it really isn't.
It's about finding a specialized guide who can help you unwind the tension, rewire that anxious nervous system, and restore a dynamic balance to your body.
Because understanding the underlying mechanics, the why behind the symptoms, changes everything about the how of the treatment.
And I want to leave you with a final thought to ponder. This is something that was buried in a subtle detail across a few of these clinical sources. When we talk about pelvic floor dysfunction as a society, it is almost exclusively framed as a women's health issue. We heavily tie it to pregnancy, to childbirth, to menopause.
It is intensely gendered in the public consciousness.
But the clinical literature explicitly notes that men, and people assigned male at birth who have hypermobility, suffer from these exact same hypertonic pelvic floor issues.
I do.
They experience chronic prostatitis, severe voiding dysfunction, and debilitating chronic pelvic pain syndrome.
The connective tissue defect doesn't care about your gender at all.
Right. The mechanics of the emergency brake apply to the male pelvis, just as they do to the female pelvis.
The muscular guarding, the autonomic dysfunction, the nervous system panic, it all manifests in the exact same hypertonic trap.
So think about this. How many men are out there right now, suffering in total silence with mystery pelvic pain?
Too many, probably.
Men who are undergoing endless invasive medical tests for prostate issues or hidden infections, completely unaware that their history of bendy joints, their digestive issues, and a hypertonic pelvic floor hold the true key to their relief.
It's a huge blind spot.
It really makes you wonder how many people are trapped by that straightforward equation we started with: weak or strong, broken or not broken. When the reality of our bodies is so beautifully and frustratingly complex,